This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how do you know if you need x-rays. If you like this video, we put out new content weekly, so please like and subscribe. So how can you tell if you need x-rays? Basically, if you have some sort of trauma that happens to you and one of your fingers, wrists, or ankles is really looking all crooked, you should definitely get x-rays. There's no question about that. And that's pretty obvious, and if you have that, you're probably not watching this video, or if you are, please go get x-rays. You probably have a broken and displaced bone. But if that's not the case, let's say you just have pain somewhere, x-rays are not a bad thing to get. They'll basically tell you if there's any fractures, or if there's any arthritis, if there's anything sort of off about your joint. And a lot of orthopedic docs, or mostly all orthopedic docs, will get x-rays very first time before they see you. But if you're certainly hurting, you can certainly wait it out for a little bit to see if you need x-rays or not. Like, let's say if you have a bone bruise, that's not going to show up on x-rays. So if you're kind of hurting a little bit and you take some time and it gets better, well, then you probably don't need x-rays. But if you hurt yourself and it takes a little bit of time and it's not getting better, then you probably want to get some x-rays to make sure nothing's wrong. It's very common that most of the x-rays we get are normal, but a decent amount of time we do get x-rays and we find fractures and other sorts of things. So that's when you want to get them. It's a pretty easy test to get. Most insurances don't fight it. It's pretty quick. It's not like ordering an MRI that takes a long time. I mean, you can almost get them same day if you need it. And a lot of offices will even have x-rays in their office, so it's pretty easy to get. So basically, to sum it up, if you hurt yourself and something's deformed, definitely get x-rays. No question, right? You got to get x-rays. If you hurt yourself and something's not deformed and you can kind of walk on it and you don't have terrible pain, you might want to wait a few weeks. If you wait a few weeks and it still hurts, definitely get x-rays. Or if you wait a few weeks and it gets better, then you probably don't need x-rays. So you got to use your judgment here. If it's hurting really bad, then you definitely want to err on the side of seeing a doctor and getting x-rays. So I hope I was able to answer your question about when you should get x-rays. If you have any questions I didn't answer, feel free to leave them in the comments below, but I can't give you specific medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.